Just a few months back, New York was fighting America's worst outbreak of COVID-19. But now, the city's positive test rate is less than 1%. And while some states are still fighting a growing number of new cases each day, New York has so far avoided a second wave of infections. But economists say this so-called success has come at the expense of the local economy. Sarah Walton reports.
At the very height of the outbreak, temporary morgues were set up on the streets of New York. Deaths peaked at more than 800 a day in April. 5 months on, and the city is now seeing a daily average of around 6 people dying from COVID-19. Health experts say that's still too many, but it shows huge progress has been made. And they credit that to tough lockdown restrictions and improved medical care for coronavirus patients.
For disease control, for those who were sick, who were dying. So the hospitals, healthcare, critical care had to get their act together. The other is testing and tracing. We were not really doing contact tracing at the time, but testing got started. And also the public health measure for general public is universal mask wearing, physical distancing. And New Yorkers also have seen the worst. They have seen literally people dying around them and ambulance sirens going all day long for days and days, so people really comply.
The city has now been gradually reopening since June, with gyms the latest businesses allowed to start operating again under strict health and safety guidelines. But with an estimated 92% of office staff still working from home, the city has avoided a predicted second wave of the virus. Some scientists believe this is also partly because there are New York communities which have developed herd immunity. Other experts are more cautious.
It's more controlling the virus. I wouldn't say it's defeated yet, but it's controlled. I mean, the best estimates are maybe 20% of the people in the city were infected at one time, meaning 80% were not. So there's still the vast majority of people who are susceptible to getting infected.
So with schools here set to reopen soon and autumn flu season just around the corner, there are concerns that the current low infection rate may not last. And that would be a bitter blow to a city where some businesses have been closed for nearly 6 months now, contributing to an unemployment rate of nearly 20%, almost twice the national average.
Those empty shop fronts are a constant reminder to New Yorkers of the balance here between a healthy population and a healthy economy.
A lot of the places that I used to frequently go to, they're closed. So I think that's what I think it's really unfortunate. I mean, in a way, that's the price we have to pay to be safe.
New York has set a very good example. The result is there, less than 1%.
I think there'll probably be another wave of it, so I think it's best that we all keep it up, and it's too soon to get loosey-goosey with it.
Health experts say other states may be able to learn lessons from New York's experience, but that it's still too early to be sure the model set here has really been successful. Sarah Walton, CNA, New York.